This is a 747-400 series. Holds about 416 passengers. Now imagine, if you will, one of these planes crashing every 2 to 3 days. Horrific, catastrophic, completely unacceptable. But as awful as that sounds, that's an often used analogy to illustrate the number of deaths due to preventable medical errors in the United States every year. Now truly, no one would be flying planes, let alone you are challenged by thinking about our healthcare situation. Now the causes are varied, but the complex environments that healthcare is delivered in, the interface between technology and our incredibly sick patients, the expectations in those environments, our ICUs, our emergency departments, it's tough. It's tough for our doctors, our nurses, our providers. Let me tell you why this is important to me. I started my career 30 years ago as a nurse at the bedside, and I have seen firsthand the incredible marvels that medicine has done in that amount of time. Tremendous. Difference in the patients' lives, incredible. But now as a hospital administrator, I'm charged with advancing patient safety and quality across the board for everyone. A safe environment for our patients, also for our physicians and nurses. What we like to call a high reliability organization, where errors are reduced. Let me give you my definition of high reliability. It's essentially an organization that performs in the extremes, but has done so avoiding catastrophe, where a small error or failure in process or procedure can have disproportionate catastrophic impact. Now, nuclear power and aviation are two examples of industries that essentially get this right. And as I said, healthcare aspires to be there. Now, I'm in no way diminishing the great work that's been done to really reduce medical errors. In my career, I've seen the adoption of technology, electronic health records, checklists from aviation. They've made a tremendous difference. But it's not enough. It's the human factors that inform these encounters, where that technology and people's lives come together in those highly charged environments. It's the burnout, the stress, performing hour after hour. It's the bias based on our previous experience that informs what we're doing in that moment. It's the distraction which robs us of our focus, taking us away from those moments. Now, I'm talking here about healthcare professionals, dedicated people who would do anything to care for their patients and deliver the very best. But this is a lot to bear for them. It's not a lack of expertise. I think what we're seeing is a lack of mindfulness in those situations because of these factors. Or better said, mindlessness. So let me start with an example of mindlessness, at least from my perspective. Have you ever arrived at a destination having driven there and said, I can't recall the route I even took or anything along the way? I know I have. Or if I said to you, lunch last Tuesday, what did you have, who are you with? It'd be difficult for some of us, I'm sure. That's classic mindlessness. See, it hijacks the now, the present moment, which is the only moment you have. See, we feel good with the predictable. We like it. But it blunts our response to the unexpected. That's critical in those high reliability organizations, in those situations that pop up, our ability to turn and to shift. But there is a remedy, another way, and it's the opposite, mindfulness. Another example. I'm sure if I asked you, do you remember learning how to drive a car? The vehicle you learned in? Who taught you? You could probably recall that, even if it was a number of years ago. Or if I said, your favorite restaurant, some items from the menu, you could probably remember that as well. Or your favorite vacation, holiday, some details associated with that, even though it may have been years ago. That's because you were intentionally mindful. You opened your mind to that dimension of awareness which is available to all of us, and what a difference it made in those situations. If you think about mindfulness, most of us go to the East, and we associate it with mindful meditation, maybe Zen Buddhism. If you look to the East, mindfulness literally means awareness, deep engagement in the now, in the present moment. I think there's a classic Buddhist story that sums up the Eastern perspective of mindfulness. When the Buddha was asked, Master, how did you achieve enlightenment? He responded, well, I walk, I eat, and I sleep. To which the questioner said, well, I walk, I eat, and I sleep, and I'm not enlightened. And the Buddha responded, when I walk, I know that I'm walking. When I eat, I know that I'm eating. And when I sleep, I know that I'm dreaming. That's it, the deep engagement, not letting it get hijacked. There's 2 studies I want to share also that looked at mindfulness practitioners. One had to do with the perception of time, reflected somewhat by this 35mm film. Imagine, if you will, each frame representing a single second. Most individuals perceive the present moment as about 3 seconds in temporal time, about 3 seconds. So when I started this talk, it's well in the past. Yet mindfulness practitioners have shown in studies to stretch that time, not additional seconds, but to dwell more in the moment, to have more time to explore the individual moment. Imagine what that can do, the creativity, the options that you could have if you could observe more in the now. Another study, which I think is equally as important, is that mindfulness practitioners have a particular resistance to noxious stimuli like pain or sound, classic distractors, which cause distress when you're trying to focus. And focus absolutely essential in those human factor situations, in those high reliability organizations. In the West, mindfulness has been seen through the lens of cognitive psychology, where it really has revolved around context, categories, seeing similarities in the different and differences in the similar. The ability to shift from mindfulness at any moment, and the ability to pick up subtle cues so absolutely important for the early recognition of some error. Now, what I wanted to do with my researchers was to take the best of the East, that dimension of awareness that, again, is accessible to all of us. Nothing I say here is new. This is a 2-millennial-old tradition if you look at the Eastern side, and put it together with the best of West, that psychological lens that I mentioned. So we designed a study. It was a brief mindfulness-based intervention, taking some of the elements I spoke about, and basically condensing it down to less than an hour. We took 2 groups of nurses, 1 to 3 years experience. One group got the mindfulness-based intervention, the other group got a placebo. Both groups were exposed to a highly charged clinical scenario, a very sick patient. They were tested after that scenario to see if there were any difference in their capacity to see error or identify opportunity. And after that, they were tested for their stress level in that scenario. Well, interesting results. With respect to the clinical scenario, both groups performed equally well, which is fantastic. As I said, these are competent professionals, and that's what you would expect. But the mindfulness group, on the stress side, clearly outperformed the placebo group by many orders of magnitude. They had less stress, more resilience, greater self-reported levels of perception and focus, higher resilience, all necessary for sustained performance in an incredibly stressful environment over time, like you'd see in healthcare. So I want to share with you now some of the key elements that were part of that intervention. And it really breaks down to 3 things. Identify the situation at hand. In our case, it might be me seeing a patient clinically or performing a procedure to them. Knowing that this is going to require focus and attention, and intentionally shifting into that dimension of awareness, being aware that you're aware. When you feel that shift happen, then you're mindfully prepared in that moment to perform the task at hand. Now, the way we do this is we use the breath, something we can all identify with, again, taken from the East. And then we put that into motion, clearly letting the breath come in and out, but also focusing on something in our environment, whether it's where you're sitting or an object that we can deeply, deeply focus on and see detail. That grounds us further in the moment, and then we apply it mindfully to the task at hand. So try it with me, if you will, just briefly. First, Imagine yourself in a work situation and some encounter you might have that you identify up front, I need to be mindful, I need to be focused right now. Once you've identified it, identify with your own breath, becoming aware of your breathing. Simple breaths, 2 of them, in through the nose, out through the mouth. Do it with me. And at the same time, either notice something in the environment here that you're looking at, or the sensation of your body in the chair, the way it feels, at a level of detail that you didn't notice before I started this talk. And you feel that. Breathe in, out, feel the sensation. When you're aware that you're aware at a deeper level, that's when you shift into that dimension. And you're prepared to mindfully perform the task at hand. It's that simple. The beauty of this is that it's cheap, it's scalable, it's highly translatable. We've already proven in the initial pilot study it can make a difference, certainly on the stress side of things. So my orientation has been to save lives, to reduce medical errors, to do no harm. But could we also use this to change lives? I've been talking about high reliability organizations, but what about our busy lives? Outside of work, the hectic compression of our day-to-day schedules. Can this make a difference? High reliability organization, absolutely, but what about our high reliability lives? Our relationships and families? Before I walk in, do I know that my children are going to be there before I walk through the door, and can I shift into that level of awareness so that I could be more engaged with them? What a difference that could make, just like remembering learning to drive or that special holiday. Our behaviors, our actions, our own health, our choices, our ability to problem solve, creativity. Imagine expanding the present moment. All important. And the biases we bring to every encounter. I don't want to do the same thing the same way every time and get the same results. This could be a remedy. So my challenge is own the moment. It's the only place where your passion, the unique part of you that makes you different from everyone else, can meet your purpose, the task at hand, in the now, which is the only moment any of us have. Don't settle for a life that you're just living on autopilot. Mindfully own the moments you're living. Thank you.